The skin is the largest organ of the body. It protects the structures and tissues located underneath and participates in the regulation of body temperature. The skin contributes to the mechanism of perception and is essential in fat storage. The skin also helps to maintain the water and salt balance in the body and produces vitamin D after exposure to sunlight. There are both internal and external factors that influence skin aging. The number one external factor is the sun. Also, the decreased sensibility of the skin, reduced mobility, incontinence, depression and dementia, use of multiple medications, diabetes, changes in the circulation, poor nutrition, and radiation from computers and mobile phones all influence the way our skin ages. Internal factors that influence skin aging include genetics, natural phenomenon, different populations, skin pH, and inflammatory response. The older adults should also be aware that as part of the normal aging process, they may experience neurosensory changes that may cause them to have a diminished perception of hot or cold water. This alteration in their sensory perception can increase the risk of thermal injury. However, deep tissue pain may be improved. A decline in lipid content as the skin ages causes skin ulcers to happen over bony prominences as a result of constant pressure when the skin does not get enough blood and oxygen. Skin health is essential in the well-being of older people. There are both environmental and genetic factors that determine how our skin will age. Sun exposure, personal hygiene, and illness all play a part in the skin aging process. During the aging process, the skin becomes a less effective barrier, which increases the risk of infection. Wound healing is delayed, and the skin is more vulnerable to damage and consequent breakdown. Older adults should be made aware that on the skin there may be some purplish spots, most often found on the arms and the legs. These spots are due to the frailty of the capillaries and blood vessels below the surface of the skin. They should recognize them as a skin change that is normal to the aging process. Stasis dermatitis is more common in elderly women than in men. It is characterized by dry, itchy skin. Exfoliative dermatitis is an excessive peeling and shedding of the skin of the older adult, which is going to cause the skin to be very itchy and increase the risk for infection. Bacterial and parasitic infections such as scabies or ringworm are frequent in the elderly. Because they have had decades of exposure to the sun, older people are at a higher risk of developing skin cancer. Shingles is caused by the same virus that causes chickenpox. It is more frequent in older adults since the pH of the skin changes. Although it can occur at any age, it is more frequent and more painful in older adults. If you suspect that you have shingles, you should contact your healthcare provider immediately because the antiviral medication given to patients with shingles works best if given within the first few days of the illness. Older adults should bathe regularly, using warm water rather than hot water. They should be careful not to overwash and should avoid using soap. They should instead use emollients or gentle products, and they should pat or gently rub their skin dry. Dry skin is due to fewer amounts of water and oil on the superficial layers of the skin. Older adults should apply moisturizers as often as necessary to maintain continuous coverage. It is necessary for older adults to protect themselves from sun exposure. They should never expose themselves to the sun without using sunblock. They should keep properly hydrated by drinking more liquids, and they should use over-the-counter moisturizers. They should use a room humidifier during the winter and in dry climates, and they should avoid hot and dry places such as saunas. Cigarette smoking breaks the elastic fibers in the skin, which contribute to the aging process. Adults should therefore avoid smoking and limit the amounts of caffeinated beverages and alcohol that they consume. It is important for older adults to maintain proper nutrition. They should drink plenty of fluids to keep hydrated and eat a balanced caloric menu. This menu should include food that is rich in vitamins and minerals such as fruits, vegetables, and grains. As people get older, they are more likely to develop certain skin conditions, but it is important that they do not dismiss all changes as normal and that they take any suspicious changes to their skin seriously. Because some of these changes can be even life-threatening if left untreated, it is essential that older adults conduct routine self-examinations and that they have annual checkups with their healthcare provider.